Okay, so what can you expect with the restorative motion procedure? First of all, restoring motion is a newer surgery that I've been doing where I actually remove a fusion and place an artificial disc to give you mobility and motion back. You're seeing this with hip surgery lately. People that have had old hip fusions in cases of tuberculosis or things, they're actually putting in hip replacements to give people mobility back. Well, we can reverse fusions in the cervical spine. It has not been done in the low back yet. The recovery time for restorative motion surgery is basically between 3 to 6 weeks with an overnight hospitalization or outpatient surgery. Not that painful, very quick recovery. Patients seem to be very happy with it so far.